The symptoms of a concussion can be frustrating and difficult to manage, especially if they persist past the standard few-month recovery time. If you or someone you know is struggling with persistent symptoms of a concussion, a brain injury, or other neurological diagnosis, like perhaps a stroke, then the following information may be very helpful. This video is an excerpt from Sarah Talks, a show I was invited on to speak about concussions and visual stress. A link to the full video and to Sarah's other shows will be noted in the video description.
This is Rogers TV, Ottawa.
Welcome to Real Talk with Sarah. Today we are talking about something that we hear about, but perhaps we don't take seriously enough. We're talking about traumatic brain injury, or TBI. When I say traumatic brain injury, it sounds so much more serious than concussion. But receiving a concussion is a traumatic brain injury, and it is serious business. If you or a loved one has suffered a concussion and you're feeling overwhelmed with where to start, or if you want to know how to manage the symptoms of post-concussion syndrome, then this is the show for you. Living with a concussion is not easy, but there are so many resources and therapies out there to help, and my guests today want to point you in the right direction. So here we go. Episode 10 of Real Talk with Sarah starts right now. Welcome back to Real Talk with Sarah. We're talking about concussions in this show, and I've got visual stress expert Karen Monet with me to share how concussion affects people's vision and how therapy can help. Welcome, Karen.
Thank you very much for having me. I really appreciate it.
I really appreciate you. We've been friends for a while now.
We have.
And I love what you do, and I really still don't know enough about it. So I really wanted to have you on to find out what the heck do you do and how does it work.
Oh.
So talk about visual stress. And I know that Lisa talked about the fact that she really dealt with some visual stress in the beginning of her concussion. How does it work? What happens?
So visual stress is a neurological condition. Now the word visual, you may think it has something to do with the eyes, but it doesn't. It has to do with the visual cortex. So back here where the visual cortex is. And visual stress, people who suffer from it have a sensitivity to visual information, specifically patterns, light, movement, and sometimes colors. And when they're sensitive to this visual imagery, the brain hyperactivates. So it gets overheated and it doesn't work properly. And unfortunately, that means they may see things improperly, they may misperceive, floors may look like they're moving, they might have blurriness, and from that, headaches and strain and vestibular issues.
So we're focusing on concussion in this show, but this can happen, anyone can have visual
About
stress?
20% of the population suffers, but it's on a spectrum. So those who are in the lower 5% are managing their visual stress by maybe taking out their fluorescent lights, reading on a Kobo, doing things like putting dimmers on their light switches, doing things that they just do naturally without realizing, and that's good enough. The top 5% are the ones where we see in the clinic, those that have severe migraines, post-concussion vision issues, autism, attention difficulties, and learning difficulties. These are the individuals who really have a hard time with this visual information, and the side effects of blurriness, movement. One of the main things, the main symptoms, the diagnostic indicators, is seeing perceptual distortions in your environment. So it could be words are moving on the page, or when you're walking down a hallway with a patterned floor, it might look like it's moving and lead to sort of vestibular issues and dizziness and nausea. These things lead to headaches because you're straining to see through these visual images, and it's pretty frustrating for people who suffer.
I can only imagine.
Yeah.
I'm just wondering, so would this be an indication of a concussion when you start to have these issues, or would you already know that you have a concussion and this is just part of the way that your symptoms are working?
The two conditions are separate. Having a concussion has its own symptoms. Many of those sound a lot like the symptoms of visual stress. So it's important to understand both, because you could be trying to treat the concussion symptoms, not realizing that it could be visual stress, and simply modifying the environment, modifying the lighting, using filters to filter the visual image can help with those symptoms. But the concussion symptoms that people first have are often headache, light sensitivity, difficulties with excess noise and movement, and these things often sort themselves out. 85% of the people who have a concussion it's alleviated, it's gone within the first 3 months.
Okay.
It's the persistent post-concussion symptoms that are very similar to visual stress. And often that vertigo, the post-trauma headaches, the visual sensitivities and the intermittent blurring and things like that can be helped with what we do at Opticalm with filters and light management and things like that.
All right, well, let's talk about what you do at Opticalm.
Okay.
Let's get into it.
So,
when somebody has a concussion and they need to get some help.
modifying the environment, modifying the light is one thing. So getting rid of the fluorescent lights and putting in specialized LED lights. Looking at the color of things. You may be more comfortable in a purple environment or a red environment. Modifying your environment to be in those comfortable colors. Moving things like patterns out of your visual environment. And this is important with the persistent symptoms, but also early on in a concussion. You say get off screens. The reason is screens are light, they're pattern, they're movement. Those are the triggers to visual stress. If you can go on a screen that doesn't have movement or flicker or color, then that can help. And we do have tablets and monitors that are made out of, they use e-paper technology. So instead of looking at LCD screens, you can look at a very large Kobo book to look at your emails and things like that. So that's very helpful. But the best thing is to filter the environment. So right now we're in a very lit environment.
Yeah.
So we use something, it's called an intuitive colorimeter. It's a medical device that was designed by the Medical Research Council in the United Kingdom. This device takes our clients through the full spectrum of color, the saturation of the color, and the intensity of the light. And this device, it's like going to hearing testing and going through all the spectrum of sound to decide what sound we need to filter. We go through the full spectrum of light to determine which color to filter. And it could be a combination of pink and rose. It could be a combination of blue and turquoise. It could be any combination of colors to get to a filter that you wear as glasses. Now, these are a prescription pair with a custom turquoise color.
Let me try them on. I'm curious.
Well, they're not your prescriptions.
They're
so
not. Okay, am I not allowed to put them on?
No, you can put them on, but they're
Okay.
not your prescription.
Wow.
So it's the same idea with color. That may not be your color prescription either.
Right.
So for some people, they have prescription glasses, but they don't want to wear their filter all the time. Like a lawyer won't want to wear these in court. She might want to just put on her filter when she gets out into the hallway. This is great because you don't have to modify the lights. You don't have to ask people to turn the lights off. You don't have to remove your patterned artwork in your home or office. You can just wear your filter. And there are 100,000 different colors that we can identify using our intuitive colorimeter. So it's not just rose, it's not just green, it's not just blue. There's any number of colors. And with the concussion market specifically, the people that we see, they are very precise with their color. They're so precise, just turning the dial just one notch and they'll be like, no, now everything's moving again. But when we get their color, they cry, they hold their heads and go, they don't have their headache anymore. All of a sudden it's gone. So.
Amazing. Well, after the break, Karen's going to share some strategies and other treatment options that may help if you or someone you know has received a concussion. Back in a moment. Welcome back to Real Talk. We're talking about concussions on this show, and I've got Karen Monet with me to share her top tips for those who have been diagnosed. So where would you suggest that we start if we have recently received a diagnosis of a concussion?
All right. Well, it seems like most people who've received a concussion or think they have go to the emergency room. And that is really to rule out serious trauma. So bleeding on the brain, skull fracture, and that sort of thing. And they're ruling that out as far as keeping you in the hospital. Then they'll be sending you home and say, contact your family doctor. And the family doctor is a great start. It's a great place to go because you need to have a baseline. You need to have a start point. Here's how we feel today. You may feel differently tomorrow and a week from now, but at least you have a start. And your doctor can understand this is what we're dealing with and start to think about where they might want to refer you out. Because your family doctor isn't going to treat your concussion. They're going to help identify the symptoms you're suffering and send you to the specialists that might help you from there. So that's a good place to start. If you're looking for information, and this is wonderful because this summer, the Ontario Neurotrauma Foundation released their third version of the guidelines for concussion and acquired brain injury persistent symptoms, what to do in a case of a concussion. So these guidelines are very detailed. They talk about evidence-based therapies that they support, and there's research supporting kinds of things that you should do if you have a concussion and if it's persistent.
So is that open to the public?
Absolutely. It's open to the public. There are two versions. There's the medical version, which is very research-oriented and big words, and there's the guide for families.
And where do we find it?
It's at neurotrauma.org. I think that's what it is. Yeah, I'd have to look it up.
Google
it's Ontario Neurotrauma Foundation .org, I think would be the best way. But Google it and you'll find the guidelines. You'll find the section for parents and families and the section that if you want to get right into the research and into the details, you can do that as well.
Excellent.
Yes. So that's a good place to start. The thing about a concussion, and you were talking about this earlier, there are so many different therapists you can go to. There are so many different rehabilitation specialists. You've had a concussion. How are you going to remember all this? You can't even read the material because the concussion makes it difficult for you to look at those patterns that we talked about, which is in text. So you need to find someone on your team. You need to hire a coach. You need to get a family member who's willing to put up with helping you through this.
Yeah.
You can also hire a case manager. And that's usually when you get into more of the longer term problems where you have someone who helps you manage all the different therapists you're going to be seeing, all the specialists.
Okay, but if you're somebody that has received a concussion and you've got a best friend, you can say to them, can you please come with me to my appointments because I'm not going to be able to remember everything.
Coming to the appointments. When we're doing our assessments, we always ask that someone come with them. And we even get if the referral came from an occupational therapist, we ask the occupational therapist to come in for two reasons. One, to learn about what we do and to see what a difference it makes on the spot with their patient. The other one is because, yes, it's hard to remember. There's so much information. It's so overwhelming. And when we're testing them, we're actually aggravating them. So we're making them even more uncomfortable because we want to find out what makes them uncomfortable so that we can make them not uncomfortable.
Right.
And that's part of our testing. But for booking those appointments and getting to all the different specialists, it's really helpful to have somebody on your team.
Yeah, on your team. And I imagine even driving to those appointments, for a lot of people, driving is an issue, I know.
A lot of people can't drive. The clients that we see are on that severe end of the spectrum. So they'll either have, through their insurance company, will pay for a driver. They'll have different transportation services that'll allow them to come into the clinic. We've had Uber and taxis. But it's great if a family member or a friend or some support person can come with them.
Now, we live here in Canada. Talk about the insurance piece, just because I think a lot of us think that there's no coverage at all if we have suffered a concussion.
For motor vehicle accidents, we've been supported by them for about a little over 2 years now, where if you've been in a motor vehicle accident, we can work on a treatment plan and propose that to the insurance for them to cover the costs of our assessment and all of the assistive tools we've talked about. And great news, in the last few weeks, the disability insurance, so Great West Life Disability, has shown an interest in what we do, and they're referring people to us. But that's something that you have to work out through your employer and your disability insurance, so it's not that common. And the other one is WSIB. We've had a lot of people come to us, school teachers with injuries on the school ground, people working and that have WSIB coverage, have paid for it out of pocket. But WSIB is starting to recognize that we're making a difference. We're getting people back to work.
Right.
The main things that stop people from getting back to work post-concussion, it's the lighting and it's the computer screens. So if we can provide them with tools to change the lighting and alter the computer screens, we're getting people back to work.
Yeah.
And the filters, the glasses are one thing. We had, I think it was a disability consultant that said, 2 weeks after receiving our lenses, his client was back at work.
Wow.
So it makes a big difference.
Does that mean the client is back at work concussion-free? Like, can these help us speed up the healing process of a concussion?
What it is it addresses the symptoms. The filters and changing the light and colored therapies and software, they help manage the concussion symptoms. So the concussion may still be there and they may be dealing with it, but these are tools that help the triggers to their discomfort be less. So we receive referrals from all areas of concussion rehabilitation, from the optometrist, vision therapy specialist, neurologist, psychologist, excuse me, occupational therapist, physiotherapist. They're all in front of people who suffer from the symptoms of light sensitivity, pattern sensitivity, movement sensitivity, and screen intolerance. So they're seeing these problems and they're realizing, okay, this is a concussion symptom, but there are some tools and techniques that we have available now that we know about that can help reduce them.
All right, so we've talked about the guidelines, we've talked about getting a case manager. What are some other tips that you have for people that get a concussion?
See an optometrist. Okay, we see a lot of people that call us, they call us and they complain, oh, I'm having vision issues. Well, when was the last time you saw your optometrist? Because we will not see anybody until they've seen an optometrist. And specifically for our concussion clients, they've had a post-concussion vision assessment. Very important, because we want to deal with what's happening here forward, what's happening with the eyes. If you've had a concussion and you're wearing progressive prescription glasses from before your concussion, you may have a hard time dealing with that change of prescription from distance to reading. Your brain may not be able to tolerate. You may have to get a new prescription. So see an optometrist. Take a look at your prescription. Take a look at what's happening with your eyes, the muscles in your eyes. You've received an injury to your head, so maybe there's some issues with your muscles that are managing your eyes. So that's where vision therapists can come in and help train those muscles. It's like a physiotherapist for your knee, vision therapist for your eye muscles and your eye teaming and that kind of vision thing. Again, talking about the head. What if when you had your concussion, something happened with your jaw? You may be having headaches that you're not relating to some kind of injury to your jaw, or maybe your teeth. Maybe they clenched and you have a cracked tooth that you didn't think about. Go to the dentist. Get that kind of thing ruled out. I'm kind of talking about the senses, right? Vision, hearing. Hearing is another one. People who have a concussion are often very sensitive to sound. So go and see a hearing specialist. Go and see someone who does visual. We do visual processing, but auditory processing. Someone who specializes in that, because they may be able to give you tools and techniques to manage your sound sensitivity. So sound, sight, talked about the dental. When you've had a concussion, you've often had some kind of damage to your neck. A whiplash often comes hand in hand with a concussion. So see someone who specializes in musculature. So your physiotherapist, maybe even a chiropractor to work out what's going on with your spine and your physicality that way. So several different therapists there. There are a lot of post-concussion clinics that have teams of specialists. So if you were to go to one that says they were a concussion specialist team, you would have physical therapy, physiotherapy, occupational therapy, and because you talked about depression, they're often, if you've had persistent concussion symptoms, you're often frustrated, you get depressed, it's affected your work, it's affected your family. So these concussion clinics also have psychotherapy, cognitive behavioral therapy, things that help you with managing the mental aspect of having a concussion.
And would people need to be referred from their family doctor to these concussion teams?
No. Sometimes yes. I think it might help if your family doctor was part of that whole program and you kept them up to date. But you can go to these concussion clinics and they will do an initial assessment. They'll bring you in and they often have a battery of tests they take you through to rule out or identify different issues that may have resulted from your concussion.
And I think the thing is, like we've been talking about this whole show, that every concussion is different.
Absolutely.
So we really can't just put everything into one box and say, this is the protocol. It really has to depend on the individual. So if they're dealing with hearing issues, starting with those auditory tests.
Yeah.
If they're dealing with the visual stress right away, start with the optometrist. And then,
Yes, that's very true. The optometrist will identify the refraction correction and the vision therapy needs, and we work with them. So if a vision therapist identifies prisms are necessary to bring in the visual field, and like if you're locked in that focal vision, the prisms might bring in the information from the ambient vision. And we can help. You might see someone who's going to help you with posture, again, to help open up that visual field. And then we can work with a filter and that prism to help you be comfortable with all that extra information that's coming in. So it's really a team effort, the community getting together to look at all the different modalities. And it's great if I know what my client has gone through, because I can then check off those things. If I see somebody with vestibular issues, I can try and address those with filters to make sure it's not a perception issue. But then I can say, have you asked your physiotherapist about benign positional vertigo? And if you haven't, and you're having vertigo, then you need to have this looked into. So as we all learn more about what each other do, we can start to identify possible additional therapies that our clients can can have done.
Well, what is amazing about you, and the reason we met, is because at the Healthy Brain and Body Show, you really bring together all of these amazing people that have different therapeutic approaches, and you bring everybody together so that we know where we can start, or we can at least figure out what steps to take depending on what we're going through.
That's something I always wanted to do. Was it's not just about what I do that can solve someone's issue. It's a part of the whole. It's a piece of the puzzle. And if we can get all these different pieces together and make this beautiful finished piece of work, a healed individual, then that's fantastic. But if some of the pieces are missing, at least if I know, well, you know what, you might find that piece over there, then we can have a more full recovery.
What I love so much about what you do and how you do it is what a collaborative approach. You know, I really appreciate that in what you do, because you really are looking at it and saying, and looking at the person as a whole person, and you're not saying that this one thing is going to fix your problem. You might have somebody come in and, you know, yes, of course they get into new lenses, but they need, you know, the help with the neck. They need the help with, they need to get to a dentist to figure out why the headaches are persistent if, you know, headaches continue after they sort of deal with
like
the
if you've
stress.
checked off all the possible reasons for this happening and there's still some empty check boxes, then that's where we can get better full recovery. We didn't talk about nutrition. That's an important one. I know you've done a full show on nutrition, but when you're trying to heal the brain needs food. It needs the right food. It needs the right ingredients to rebuild. And so nutrition is a big one.
And healthy fats are so key, aren't they, when it comes to concussion?
The other one was cognitive behavioral therapy. Oh, and neurofeedback. Okay, that's another one that you don't hear a lot about, but I've had clients who've seen great success with it. And it's the idea of teaching your brain to act differently. And you can, by having this neurofeedback, you're sending signals to the brain as you start to get off track. And I'm going to be learning about this in about a month and a half. I'm taking my son, who has visual stress and wears his turquoise glasses. He's had concussions, but he was born with it. And we're going to take him to get a quantum EEG to see the brain mapping of what's happening when he's wearing and when he's not wearing his lenses.
Wow, that'll be amazing to see.
Yeah, it's going to be fun.
I think we have a minute left. What else do we need to cover?
You talked about the Healthy Brain and Body Show, and I think that's something that's a great place for people to go in the spring to learn more about concussion and what kinds of things they can do for therapies and rehab.
And that's here in Ottawa.
Yes.
So that means that you get to come back and be surrounded by all of these amazing people that are now in your referral network that you've really created. I really feel like you have hand-selected all of these people that are now in this referral network, that for anybody who is suffering, or if parents have a child who's suffering, now we have a place that we can go, where we know that we can talk to you and you're going to say, listen, you can also go to these other places.
Right.
It's amazing.
It's not just about what we do, it's about what we can all do
Well,
together.
Again, it's what we can all do together, because we are talking about a whole person. It's about collaboration and collectively coming together to help heal that whole person. We have 30 seconds left. Tell me one more thing about concussion that you think is important for people to know.
Well, de-stress. Okay? Stress can lead to discomfort, and yoga therapy, mindfulness is so important. Be positive thinking. Yeah, I'm going to get better. Think positive.
I love that. Thank you so much for being
very
here.
welcome.
When we come back, I'll share my final thoughts. Back in a moment. I dedicate this episode to anyone who has suffered a concussion. I'm overwhelmed by the number of people I've met in the last few years who have been affected. My dear friend Karen suffered one when she tripped while running over 2 years ago. And my 13-year-old niece Olivia fell out of bed and hit her head and suffered a concussion last year. Their roads to recovery, like so many others, haven't been easy, and I wanted to spend this hour highlighting the importance of this topic. It is my sincere hope that something you've learned today will help you or a loved one on their road to recovery. And if nothing else, I hope we will all practice greater kindness and compassion towards those suffering. Because there are often no obvious symptoms, stigma and shame surround those with post-concussion symptoms, which only drives them deeper into feelings of worthlessness and powerlessness and fear that life will never be the same again. But what we've learned today is that there is so much hope. Life may not ever be the same as it was before the concussion, but different doesn't have to mean bad. As my first guest, Lisa Cara, shared, her life completely changed because of it, but she wouldn't change a thing if she had to do it all over again. There were lessons inside that she needed to learn, and because of the approach she took, she is living proof that healing is possible. Thank you to Lisa and to Karen Monet for sharing some powerful strategies people can use when they have a concussion and for explaining some of the ways concussions can be treated. Until next time, I want you to remember one thing, that no matter where you are and no matter how it feels, you are never, ever alone. See you next time.